People with diabetes can lose their legs. It is often forgotten that people with diabetes can die, can have an increased mortality because they lose their leg. So they lose their leg and they lose their life also. Now, how to prevent it is very easy. You have loss of sensation in the feet and less of blood supply. So don't smoke and wear footwear always. Inside the temple, inside the house, wear footwear and examine your feet every day for cuts, bruises, and prevent an injury to the foot. So people with diabetes should take care of their feet, examine their feet every day, and also wear footwear always inside the home. Now, even in a temple, you need not walk barefoot. You can wear socks. There is worship socks available in the market, and you have to wear socks inside a temple. Nobody is going to object to it. So inside a mosque, inside a temple, you can wear socks and prevent an injury to the foot. And therefore, person with diabetes can live a longer life and go with two legs and not lose one leg. So in the sequence of events, the sequence of using tablets or medication, first comes GLP-1 receptor agonists or SGLT2 inhibitors, followed by metformin, pioglitazone and insulin. And anyway, people with diabetes need polypharmacy. And in the sequence, don't forget the SGLT2 inhibitors and GLP-1 receptor agonists come before metformin. So that's a very important point to take home. So the European Society of Cardiology says use SGLT2 inhibitors and GLP-1 receptor agonists before metformin. But the American guidelines say, and the ESD guidelines which came together, still say that you should use SGLT2 inhibitors after metformin. Now, the data is coming so strong that it's only a time, by the time the next guidelines are written in 2025, or 2026, that SGLT2 inhibitors and GLP-1 receptor agonists are used even before metformin. You can't lose time. People with pre-diabetes also have cardiovascular, kidney disease and so on. So you can't lose time. So anyway, people with diabetes need polypharmacy, and you'll end up giving SGLT2, GLP-1 receptor agonists and metformin and pioglitazone. So why not use this drug even before metformin? So that is the American guidelines which should change in the near future. The Indian guidelines, the ESI and RSDI, still say that you should use metformin first, followed by SGLT2 inhibitors. Even they should change. And I think the SGLT2 inhibitors and GLP-1 receptor agonists must be used well before you use metformin, even in the stage of newly diagnosed type 2 diabetes. Because newly diagnosed type 2 diabetes and pre-diabetes have a lot of heart disease, kidney disease, and so on, and liver disease, and so on. This message is specifically meant for clinicians who treat diabetes. And metformin used to be the first-line drug. But why, when we have so much of data in people with diabetes and without diabetes? So I feel that SGLT2 inhibitors and GLP-1 receptor agonists should be the first-line drug, followed by metformin, followed by pioglitazone, followed by insulin, and so in that sequence. Now, it's very important that earlier days we were talking only about diabetes. Today we are talking about diabetes, kidney, liver, heart. So it's very important we use drugs which have got benefit on those organs also. So it is very important to use these drugs much before metformin. Anyway, people with diabetes have polypharmacy requirement, and they need SGLT2, GLP-1 receptor agonists. They have metformin, pioglitazone, everything they need, especially long-term people with long-term diabetes. So use SGLT2 inhibitors and GLP-1 receptor agonists even before metformin. And the guidelines should change in the years to come.